Hello, everyone. Welcome to this session. We will be waiting for 1 or 2 minutes for the other attendees to attend, and then we will start the webinar. All right. So I think it's time to start. So welcome, everyone. This is a session on COVID-19 response, and this will continue. This will include 2 great presentations. And just before we get it started, I wanted to mention that we are recording this session. So just as a head up and be informed of it. So now I would like to invite Heather Albrecht, our first presenter, for presenting her work on how Hennepin County refreshed thousands of laptops during the COVID-19 pandemic. Heather is a GIS business analyst at Hennepin County. So Heather, welcome to the session. The stage is yours.
Thank you. All right, I'm gonna fumble through sharing my screen here. All right. Thanks for attending my session on, let me see here, one more thing. Get this floating panel out of the way. All right. Thanks for attending my session on the COVID-19 continuation of services at Hennepin County. I've been at Hennepin County for just about 2 years now, which means 6 months into my time at the county, a global pandemic struck, COVID-19, and we were all told not to return to the office. Continue working, but work from home for the time being. In order to accommodate 9,000 approximately 9,000 county staff working from home, some still had to perform in-office duties, but for the most part, we were sent home. And to accommodate that, county decision makers decided that we should all receive new laptops to make sure that we had high-performing equipment and reliable equipment so that we could continue services provided to our residents. And so the county embarked on a project to basically deliver 9,000 computers to staff who are distributed all over the county, all over the state, all over the country. So here's the project. For every Hennepin County employee who uses a laptop, and actually more use a laptop now than they did at the beginning of the project, they're going to receive a new one. So we're going to refresh approximately 9,000 computers, and then abiding by COVID-19 safety protocols. So the county plans to replace all the laptops. With that, they're going to deploy all the kits and equipment that we need to utilize that technology at home. We want to ensure to protect our staff from COVID-19. We want to empower staff to utilize their new software from home, and also to configure it on their own. And then we need to also collect the equipment that people took home with them, their old computers, which now have, potentially private county data on it. And then we need to be able to track all of that. So it was determined kind of early on in the decision making, how are we going to get these computers to staff? Should we have staff come to a centralized location, such as a county facility? And that was determined not to be the most safe option because we didn't want people congregating due to COVID-19. And then we had staff who would potentially be laid off, such as librarians and library staff, due to the closure of those facilities, that we were able to actually utilize and keep them employed by deciding to deliver the computers to people's homes. So 9,000 staff receiving a computer at their home, hand delivered by a county employee. How are we going to do that? Well, first we need to figure out, where do our employees live? So GIS put in a data request to the HR department for a list of addresses. We geocoded those and aggregated them by zip code and created the green choropleth map on the left for me, that shows kind of the frequency of where people live. Generally pretty close to the Hennepin County Government Center, but staff do live further and further out. And then we need to determine how far are we willing to drive. So we created a drive time analysis, starting from the government center. That's where the computers were going to be shipped and the vehicles were going to be stored, so they'd be loaded in the morning at the government center. Drivers would take their routes to deliver the computers and then return to the government center. So how many staff live 30 minutes from the government center? How many live 60? How many live 90 or greater? Looking at the distribution of staff and kind of the effectiveness, efficiency of deliveries, it was kind of determined it's actually more cost effective if people live greater than 60 minutes from the government center to just go ahead and ship those computers to their house. If they live 60 minutes or less, then actually it's more efficient to do deliveries to their home. And there's a high concentration of staff that live in that area, making those trips worthwhile. So for any staff that were greater than 60 minutes from the government center, they're really thrown out of the rest of the analysis. And we shipped the computers to their house using the Postal Service or UPS. We sent them a shipping label and instructions on how to safely wipe their computer of data. And then we paid for the ability for them to ship their old ones back once they received and configured their new ones. For those staff that live 60 minutes or less, we needed to figure out, okay, how should we go about this? So we started to think about, okay, let's break these staff down into delivery zones. So there's a high concentration of staff in a specific area. We will deliver to them on a weekly basis and continue to select staff that live in close proximity to each other for deliveries each week. And so kind of our proof of concept is the pink image on the bottom there, and what those zones actually ended up looking like are displayed on our hardware refresh tracking dashboard. And as you can see, the further we get from the government center, the bigger the delivery zone. Staff are further and further distributed apart. So in order to efficiently deliver computers to staff's homes, we need to know, when are they available, or are you going to be available for a delivery? And then also verify that they're staying where HR thinks they are. Turns out in the middle of a global pandemic where people can work from anywhere, they're not necessarily at home, or they may have moved and not notified HR. So we needed to verify delivery address and availability. In order to do that, we created a Survey123. Now, in order to find out availability, we didn't send the Survey123 to 9,000 staff in March to notify them that they were going to get a new computer in 2020, we decided to send each delivery zone, the staff that would fall into each delivery zone, their survey 2 weeks prior. So we would give them a window of time for them to say, yes, I'm going to be available. So how do we come up with 500 staff per week who would receive their new computer? Well, it really was based on the capacity of our enterprise service desk, our technical support team, to assist staff who were configuring their computers at home. So when your computer would be delivered to your house, it would be in the box, unopened, sealed, and staff connected to the internet, logged in with their county credentials, and a system called Windows Autopilot took you through a series of steps then to connect to the county's network. So staff were actually configuring their brand new computers from home. So I'm just going to kind of walk you through our Survey123. So each week we sent 500 staff this survey, asking them to provide an at-home delivery address. If they chose not to provide one, then they would be sent instructions to pick up their laptops at the government center at a designated location and time. If people did not respond to the survey, they were also sent those instructions. But for those who accommodated the survey, filled it out, they were delivered a computer to their house. So you were asked for your login information, and that actually became really the primary key for all the integrated systems for the project. What's your name? And if you choose at-home delivery and you want to share your address, where can we find you? And how can we get a hold of you if we have an issue with your delivery? The last question was whether or not you're going to be hooking your laptop up to some external monitors and whether you need some specific cords for that, depending on the age of your monitors. So if you need a display adapter, then we'll throw that in the box or in your package. So once staff submitted the form, what we found out was people really didn't live where we thought they lived. So that was an interesting challenge with the project. So we would get a list of addresses. So many people chose home delivery. A few people chose pickup and some didn't respond at all. They would kind of be pushed out of the next stage of analysis and given instructions to pick up their computer. For those people that chose home delivery, we had to geocode all of those new addresses and then overlay that with our delivery zone area, so the polygon, and determine whether or not they do indeed still fall within that delivery zone. If they did not fall within the delivery zone, they were essentially eliminated from that week's deliveries and pushed out into a future delivery zone. And so once we geocoded all the deliveries, verified that they were indeed in the delivery zone, then we created efficient routes. And we did this inside of ArcGIS Online using some network analysis tools. So we set in some parameters, including how many hours a day they're going to work. I think we probably put in closer to 6 or 7 than 8, just to accommodate, their breaks throughout the day. And then in the morning, arriving at the government center, loading up all the computers, ensuring that they're able to return at the end of the day, and then giving them about 10 minutes per stop. And usually they were typically back, I think, by 3 or before 3. And so they were able to do about 20 stops per day per driver. And so to assist the drivers with their deliveries, we used Collector. We created a web map for each of the deliveries so that the driver would really only focus on the job that they need to do and not be distracted by, all the other routes for that week. So they'd be assigned a route. They would open the web map that contained the route that they're to traverse. And then also they're going to track their deliveries within Collector as well. All right, so that was, we did that, training obviously with our drivers, and then we created training videos for reference. So for staff that weren't going to be having their computers delivered to their house, and rather they were going to be going to the government center to pick it up, and for those that were shipped, we utilized Survey123. So why did we decide to use Survey123, which is an Esri technology for a not map-centric part of the project? And there were some real advantages, one of which is security of the data. We're able to utilize ArcGIS Online credentials, which we could quickly and easily distribute to anybody involved with the project to log in and access the data. We were able to utilize our SDE to publish services to each of these different components of the project so that the data stayed integrated. So for instance, if somebody was to miss their delivery, they would be asked to come to the government center and pick up their computer, and their record would be available in the pickup app, in the Survey123 app, just as it would be in the collector app. It's important that the records existed within the app because we needed to verify this person is a county employee, this person is expected to get a computer. So we use the searching functionality of the application to find employees who in fact are required to receive a new computer. Some of the other advantages of Survey123 are just the ease of configuration, the ability to pre-populate values, so less key and entry issues. And then a big one was that we were once again using the mobile devices to track the distribution, even for pickup. And so if you were working at the pickup desk, you would search by the Active Directory name, the computer login, and the employee name would auto-populate. Then you could verify the identity of the staff person based on their Hennepin County badge and find out, yes, indeed, this is that person. They are to receive a computer because their name exists in the database, and they selected that they wanted an adapter when they filled out their initial form. You won't see it here because this is the desktop version, but on your mobile device, you're able to utilize the camera to scan the serial number of the device, which is just simply taken off the shelf. It's not pre-assigned to this person, to verify without any human errors which computer each person received, and then who and when was it delivered or picked up. So list of staff here who worked on distributing the computers, and then the status is important to be changed. Oh, it was supposed to be set to planned. From planned to completed. So actually, that was an important step in the process because planned distribution or pickup was searchable within the pickup app, and you could verify that person was supposed to receive the computer. But once they completed their pickup and this form was submitted, that record would actually transfer over to a return app that we would use for when we were collecting the old laptops. So that's an important step. You have the ability to put in notes, and then if the laptop was shipped, we utilize the same form as if it was picked up, just noting that it was shipped, and then we would include things like a return label and instructions. All right, so tracking. This is another thing that we were able to do in real time due to the services published from our SDE. We were able to provide real-time information to stakeholders and management about the status of the project. So expensive project, important project, lots of laptops, changing hands every day. And so if you focus on the dashboard at the top, what you're going to see is delivery week 8. So we have the dashboard filtered to show that 432 of the 500 have been delivered. 51 are in progress. And so that means they either haven't been delivered or picked up yet. And then you'll notice those numbers don't add up to 500. that means that some of those survey respondents didn't live in the delivery area or weren't currently residing in the delivery area, and they had to be pushed out to a further zone or potentially even shipped if they were up at their cabins or something like that. And then the projected. So the projected, that number really doesn't change whether or not you're filtering. The projected is the numbers of computers left to distribute. So we pre-populated the database with every staff person who is assigned by their department a laptop user that was identified at the beginning of the project. That allowed us to search for their records and verify we have the right staff person and that they do indeed need a computer. And then the last thing is completed. So one person out of this zone completed their return. So they got their new one and returned their old one. When you look at the bottom, now you see the project as a whole in real time. We're not filtering at all. And you can see we've delivered about 4,500. We have 2,000 in progress. And really that had a lot to do with people not picking them up. So the more weeks that we went on, the more in progress that accumulated over the weeks from people that hadn't picked them up, during their delivery window. Perhaps they're on vacation or something. Projected stays the same, and then we have a lot more returns. So why do we not have completed and returns that are equal? Well, we don't exchange the computers at the same time. What we had to do, because people were configuring their computers from home, we had to verify that they were able to continue working before we could collect the old laptops. So you would receive your computer at your house, or you would come and pick it up, and you weren't expected to return it for 2 weeks or more. And so in that 2-week period, you were given time to configure and walk through the steps to connect to the network with your new computer, and then also to verify that any data translated over successfully, and then reach out to technical support and work through those tickets if needed. So once you returned your old laptop, it was quickly thrown at the top of a stack of computers that were being wiped and recycled. So you really needed to verify that you were indeed ready to get rid of your old computer before you returned it. So it really created kind of a twofold project where we really focused really heavy up front on distributing. And then as that waned, collection ramped up, and we needed to really verify that we got every single computer back. And it never changed hands from a Hennepin County employee because of the potential for sensitive data to be on a computer once it's been used by staff to do their jobs. So the security of the used computers really became an important focus of the project, in the later stages. So what's next? Well, before we get to what's next, some of the challenges, I threw those on here. The ability of the drivers changed all the time. People were quarantined, people were sick or unavailable just generally. People were called back to work, so then we get a new set of drivers. So trying to get that 500 per week delivered, and continuously training new drivers, giving them credentials became somewhat of a challenge, but we overcame it. Opening and closure of public spaces due to safe COVID-19 protocols. The government center would be open, it would be closed. If it's closed, then nobody can pick up or drop off. Civil unrest. We had the murder of George Floyd in the middle of this. We had protests near the government center, causing safety and access concerns. And then again during the trial of Derek Chauvin, and we actually had the government center closed for an extended period and kind of high security, where even for this project, people weren't allowed to access. Even staff couldn't access the government center. So we had some challenges, and I think the major challenge that I didn't post here was that we were the humans were the assets. So I'm an experienced asset manager, and went into this project thinking the laptops were the assets, but it was really the staff. And people don't stand still like a sign or a hydrant. They do things that are unexpected. So there was a lot of data maintenance, a lot of changes, a lot of reporting, that was required to make sure that we track down every single employee that needed to both receive and return a computer. So it was an interesting, fun, challenging project. And originally the GIS department was not going to be involved with the distribution of the desktops because it's not a map-centric project. Desktops are being configured at the location that they're going to be used within a Hennepin County facility. So we didn't need that map and routing aspect it because of the success of the laptop refresh project and the user friendliness of the Survey123 app. We're actually been involved to recreate the app for that project, which is now underway. So we're tracking the receiving so that the shipment has been received at the facility, the distribution to a staff person or workspace, and then the collection of the old ones. So GIS is assisting with that. And then there's talk about 4,000 iPhones. I don't know if GIS will be involved with that, but I didn't think we were going to be with the desktops either. So threw it out there. And then I just have kind of a fun animation of the change over time throughout the project that can segue us into questions. I can read these. First one is, does your county typically track equipment using the factory barcodes? We've been contemplating what makes the most sense for us, custom asset tags or factory barcode. For this project, we transitioned away from custom asset tags to the barcode. And so that started with the laptop refresh and it's continuing now through the desktop refresh, and that's a change of process for us. And then the second is, do remote workers use virtual machines to run resource intensive software at home? And the answer is yes. So we have always on VPN installed, and that was a change over from pre-pandemic when we used Pulse Security to always on VPN since we were always working from home. And then we do have, I believe it's Citrix virtual desktops. So the GIS department will be included in those that have access to virtual machines.
So thank you, Heather, for your presentation. That was great, but we will still be having extra 2 minutes. If there's any other questions or comments or something, you can throw it into the Q&A box or unmute yourself and speak up.
If no more questions, I guess I'll just say thank you for attending my presentation and listening to my most challenging project yet.
All right, if there's no other questions, then probably let's move on to the next presentation. Thank you, Heather, for your great presentation. That was really interesting, very informative work. And thank you for your excellent timing. Now, let's move on to the next one. I would like to invite Jared Hovi and Siona Roberts. Jared is a GIS coordinator and Siona is a GIS specialist for Carlton County. They are going to talk about their collaborative work fighting the virus, one survey at a time. Their collaborative effort and creative approach has been cited in multiple publications as and described as a strategic partnership between GIS and public health, which led to Esri's SAG award. So excellent work. Jared and Siona, you have the stage. So please feel free to share your screen and start.
All right, well, thank you for welcoming us here. And I'm gonna get these controls all nice and configured here for us so I can get some things situated. And see here. All right. Well, welcome everyone. I am Jared Hovi, the GIS coordinator at Carlton County. And with me today, I also have.
Hi, everyone. I'm Siona Roberts. I'm the previous GIS specialist for Carlton County, and I am going to kick things off. So thanks, Heather. That was an awesome presentation, and I hope everyone's having a great conference so far. So back in July of 2020, you know, we were all the start of the pandemic. We all know how it went, how it's going. And Carlton County decided to set up their incident command system, which was primarily made up of public health staff and emergency management. And GIS was asked to sit on this team to help with the response and planning phases. And one of the major components of planning was trying to prepare and plan for a mass vaccination when a COVID-19 vaccine became available. And public health had this plan, this awesome plan to do a drive-through scenario to really minimize human contact and really push that social distancing aspect and keep everyone as safe as possible. And one of the pieces that was discussed and tried to plan for was record keeping. And up until that point, it was going to be record keeping was going to be done on paper forms with clipboards and pens, and then they were going to be the resources were going to be sanitized between use. Well, from Jared and I sitting on in these meetings, we thought, well, how about we use like a digital platform for this? And we could possibly use Survey123, and that's what we ended up doing. We were able to completely eliminate paper forms through the whole process of vaccination and transform everything to Survey123 and the use of ArcGIS dashboards. If you could scroll on, Jared, please. So before Jared takes it away, showing you the forms and everything and the nuts and bolts, I'm going to show you a quick map here of the drive-through scenario, just so you have a nice visualization of what was going on. So the drive-through scenario, most of our clinics took place at the Barnum Transportation Building. It's about 20 miles south of Carlton. And it was broken up into different stations, which are marked by the pink flags on the map. So basically, folks would enter following the blue line. You can see station 1 was our greeter. So they were basically just doing traffic control, kind of explaining what was going to happen. And then you can see here where it turns from blue to red. When it was time for vaccinations to take place, the doors would open. They would allow about 15 to 20 cars in at a time, and they would reach check-in. So check-in was basically, we had employees with iPads with their Survey123 forms on the iPads, where they would be confirming folks' personal information and making sure they are who they are. And then once they were confirmed of their identity, then they moved up to vaccine dispensing. So at vaccine dispensing, this is obviously where they had their vaccine administered by nurses. And then we also had other employees working with iPads, assisting the nurses with record keeping. Once they had their vaccine administered, they would move up to station 4 to rest and recovery, where they would spend 15 minutes waiting in their cars, windows down, engines off, just making sure there were no side effects from the vaccine. Once they had done their 15-minute wait time, they would be on their merry way. So with that being said, I'm going to turn it over to Jared.
Well, thank you, Siona. And what I'm going to do here is we're talking about the pre-registration piece, and I went ahead and filled out a lot of this information beforehand, just to expedite the time here. And one thing that we really learned working with our public health and human services, which we hadn't done much of in the past, was just learning their forms and what they needed. So this is what we kind of came up with for pre-registration. This was sent out via QR codes, email links in the beginning phases of the pandemic. And then as we moved on, we also stood up a call center for those that did not have access to technology via computer or smartphone, and they would fill the similar information. So this is just kind of what was put together. We did the hyperlinking to the vaccine information sheets, something people could read beforehand, and also they could always receive a hard copy on site if they wish. So there's a lot of required fields here that they agree that they would go through this, they read it. And then what we used was actually Survey123 Connect for this, because our data was actually residing on our server. And through that, we're, just like with the web version, we can always do logic in there. So some of this that we did was, if it's your first or second dose, if you did second dose, we just put a notice in there that you must receive the same presentation. So AKA the same vaccine as your first dose. You don't want to be mixing Pfizer with Moderna, etc. Part of one of the things that we learned though is we used to have some nice graphics in here, and as we stood this back up for this presentation, they disappeared. So the joys of GIS that we've stumbled across. So I was going to switch this back to first dose, more logic. Did they want to have a email reminder for their second dose? If they said yes, they could just put in their email address. Walking through this, fill this out, and what I want you to just kind of focus on is this last name. I just put test in there with my first name. We'll cover this more through the other steps that we'll go through with check-in and vaccination. Date of birth, one thing that we really were trying to accomplish was by putting in the date of birth, it would auto-populate the age. While we could get this to work in a cloud environment, once we moved this data over to our server, we really struggled to get that populated, but in the end, it did work all fine. Moving on down, we did pre-populate some things just for consistency. So like state, you could type in, you'd have your choices. That way, just for consistency for people putting in MN or spelling out Minnesota, there is always consistency within that. One big portion of this was the phone number. We requested the phone number mostly because it was there to help expedite the check-in process. When we're looking at 400 or 500 individuals a day, the scroll through the next steps to find these people was time consuming. You could have multiple people with the last name, etc. So a phone number became kind of a unique identifier to find these individuals. And then insurance, this is one thing that we also learned along the way is when we first did this, we just allowed people to put in their insurance carrier. Not that the vaccine is being charged for, but Public Health Human Services could gather a fee for administering the vaccine. And to help with the billing department, we didn't end up putting in actual choices because we were getting some people that would put in BCBS for Blue Cross Blue Shield. So just working with those different partnerships, we learned a lot and what was important to them and what was being used, and we would pivot and make things work as needed. So I'm just gonna leave it as no insurance just to save time. And then these are just your basic screening questions that are out there. So I'm going to leave this one. Are you sick today? I don't know. We'll kind of cover that one more later on in the process as just an example. So I'll quickly scroll through these. And I'll come down here to this clinic ID. Another lesson learned was as things started to ramp up and vaccines became available for the general public, there was multiple clinics a day. And we needed to sort that data to have it lined up for check-in and vaccination processes. Otherwise, we're getting thousands of records in our system. It was being kind of cumbersome to sort through. And also in the end, these clinic IDs would help us manage our dashboards in different operation settings. In this instance, we just had one. We would go with unique words, tea, duck, sun. We pivoted to that because we tried to do kind of a numeric system, but people wouldn't really think about it. They would just pick one without actually going back and looking at their email or whatever information that they received in which clinic to attend. So we found that unique words really made people think a little bit more about it than just clicking on one. Digital signature, and once they're done, they would hit submit. And that will go through our system, and we will look at that next. So I'm going to jump back here to our story map, and I'm going to cover the check-in process. So as Siona mentioned, people would come on site, they would get to station 2 here, and we would do the check-in process. So quick launch demo here. And this is a dashboard that we set up. And as I mentioned before, if there's multiple vaccine clinics going on in a day, we'd have multiple tabs actually down here. So you can see here's T. This is actually the one that was done at the Black Bear Casino in conjunction with Fond du Lac Tribal Public Health. So you'll see in here, we got just some named examples and things like that. And if you're looking at checking someone in, you have hundreds of records to scroll through, that is very time consuming. So as I mentioned before, the phone number aspect. So if you could type in someone's phone number, it would actually start to auto-populate. You could find that one individual and check them in. You didn't have to scroll as much. Also, date of birth and last name were options, but we found the phone number was the biggest contributing factor to speed this up. So once they'd find the individual, verified some information, they'd click on this little inbox here. And what this would do is actually it launches another Survey123 application to continue putting in information. So they can verify this data. This was put as read only. They could not change this. We didn't want any finger slips or things accidentally being deleted. And this one was very simple. It was to check them in on site. And the reason we did this is actually it filters into the next process of the vaccination, and Siona will cover that here shortly. So I will submit that, and I will get a screen mode here, full screen, and bring us back to our story map and have Siona talk about vaccine dispensing at Station 3.
Thanks, Jared. So as Jared said, when folks were checked in, then they would move on to vaccine dispensing. So Jared, if you could launch the demo for me, please. Right, so Jared, test Jared had been checked in, and once he was checked in, he would disappear off the check-in dashboard, and then he would pop up on the vaccination dashboard. So you can see we still have the same search functions if the list got really long, by phone number, date of birth, or last name. You can see that test Jared, all of their personal information is popped up here to confirm that that is the person they are indeed vaccinating. And then it also gives them if they're on their first dose or their second dose. So once they had confirmed the person they're going to vaccinate, they would click this little icon here. And it would open up our third Survey123 form. So as you can see, it's fairly similar to the check-in one. It has all of their personal information as just a way to confirm that that is who they say they are. None of this stuff was editable, just for slippy fingers. And then if we scroll down a little bit, then we get to the screening questions. So these are all the screening questions that were answered when they did their pre-registration. The nurses, before they could give the vaccine, they were required to review all the screening questions again with the patient. And say if an answer had changed since they had pre-registered, such as in the case of, are you sick today? Well, if they said they didn't know, then when they were on site, the nurse could ask them again, and then they could put in their current answer. So yes, no, what have you. So then if they had gone through all of their screening questions and they were indeed like good to go for the vaccine, if we just scroll down, there we go. There's this question up above. Jared, if you'll just scroll up a tiny bit, scroll up a little bit. Yeah, did the person refuse the vaccine? So if none of their screening questions were didn't allow them to get the vaccine, then they could click that to no and then submit the form. Otherwise, if they were able to get the vaccine, then they would start filling out this information. So whether it was in the left arm or the right arm, the location of the vaccine being administered. So in this case, it was Black Bear Casino, the vaccine name, the manufacturer. And then for all of these options, we had an other option as well in case, we had missed something in the form. And then there was the vaccine lot number. So you can see the first option is a legitimate lot number from the vaccine. And then we have some colors. So in certain cases, we would sometimes get shipments of vaccines in pretty close to the start time of the clinic. And we wouldn't have time to update our forms and be able to test everything. So as a backup for that, we put some colors in here. So then if a new lot number came in, we could assign a color to that lot number. And then after the vaccine clinic, we were able to go in and manipulate the data and replace that with the correct lot number. And then if there was any comments about the vaccine, they could enter those in, and then the vaccination date. And then the next two pieces of information is the nurse name and title, and then the recorder name and title. So this was kind of like the signature component for the nurse and the recorder. Like we said, at the vaccine dispensing station, we did have someone recording all the information so the nurse could just focus on the patient and do the vaccination. So then once all of this information was filled out, they would be able to submit the form. And then the last question was just because we did collaborations with the FDL tribe. So FDL just wanted to know how many tribe members were attending these clinics. So once this information was all filled out, the form was submitted. And then once the form was submitted, they would be removed from the dashboard through a filter. And then once they had their vaccine dispensed, they would move up to rest and recovery, where they would do their 15-minute wait time. At rest and recovery, we also had another form. It was we'll just have it load here. So it was a participant survey. So we had this participant survey. It was just super helpful to kind of gauge people's opinions of the clinics and what we could do better. So we gave people like a QR code that they could scan with their phone to complete this survey. Otherwise, we just had folks with iPads for people that didn't have cell phones or like smartphones. So just some of the questions: did you tune into the radio station? We did have a radio transmitter transmitting a message about what to expect throughout the drive-through clinic that people could tune into. Just a clinic rating, and then their comments of why they rated that way. And then just a final question of, would you be willing for us to share your anonymous participant survey with the public? And we wanted to do this to try and share positive feedback about vaccine clinics and just share positive information. Thanks, Jared.
Thank you, Siona. All right, well, what I remember Siona coming to me with this idea of doing this, and it's like, well, yeah, this is definitely most things are certainly possible with GIS, and we worked through it. We used the Esri health screening solution that was put out there, and kind of used that to figure out, well, how can we connect these forms together? How can we take a unique person and move them through all these steps? And well, with our data and of course a unique or global ID, excuse me, you can do that. And so you can kind of remember this check-in dashboard here, and we put this in the edit mode to kind of show you how this worked. I'm going to just kind of go through the configure here. We're going to go over to the list option, and then I can actually pull open the source. So there's some HTML coding back here that we learned a lot about. A lot of this information up here at the top is just kind of talking about how to create the layout, the colors and things like that. We tried to do different colors so it was more intuitive to the end user. And back to connecting these forms, what we did is basically, you can see this little icon down here. It's the same check-in box as over here. And we'd reference a website. So you can see it's going to Survey123, and then here's our unique item number for the survey that it's going to bounce through to. And what it would do is it put it into edit mode. So open the survey, put it in the edit mode, and when that's getting pushed through, be sure to grab the global ID. So we use global ID. We didn't want to use name or anything like that, because again, you can run into people that have the same name. And we got to that point and we were running into errors. And of course, they were the good old Esri errors of don't work, can't find data, etc. And we could not find a solution. So we reached out to a local vendor and we troubleshot this together. And what we found was this little piece here at the end is what made the difference. It seems like using the latest version of Survey123 through Esri is a big component. So once we put in that little bit of verbiage, it worked just great. So a little tip, trick there, not only for vaccinations are we using this dashboard to survey platform, we've also started implementing this for different applications here at the county, even things down to our service department for vehicles, using this to keep record data management. So there's a quick little tidbit there, and I'm going to go back to our survey, or excuse me, our story map, and probably thinking, boy, there's all this data. I mean, we're getting data in. It's not really a spatial component, but it is information. So in our command room, when we were doing these vaccinations, we did have set up this nice dashboard, and it provided a real-time situational awareness of what was going on. And through this dashboard and also the other dashboard forms for checking in and vaccination, this data would update every 30 seconds. So it's not like we had to be sitting there and hitting refresh or anything like that. So we could always look at, and of course, we built these based on those clinic IDs. So this one, that's all the T data that's falling into it. So we can see there's 12 people registered. They've done 7 so far today. And so, well, now we're up to 13, and we have 6 people that we're still waiting for. We'd have this progress bar that would adjust as the numbers were coming in. And then we could always look at too, okay, how many individuals are out there in the garage that are checked in but not yet vaccinated. So this provided a really nice sense. When we did this, we had volunteers, county staff working on these. And if we'd have gone with paper forms, they'd just probably go into a bin and be entered in at the end of the day. And we'd have individuals walk through on the breaks, and you could see at first they'd be walking and they kind of do a little back step and they'd look at this. And granted, we had masks on and all that fun stuff, but you could tell there was a smile behind there, that they could see the progress, they could see that they're making a change and things were flowing well. Over on the left-hand side, as Siona talked about earlier, this was our participant survey, the comments that were coming through. Such wonderful comments. I mean, this is everything that we gathered and we wanted to put it in there for this demonstrative purposes. And then down here is just our rating on what was, excellent, good, fair, or poor. And one thing we kind of learned right off the bat was, well, we had some fair and poor ratings, but people were not leaving comments. So we actually changed that survey. So if they did give a fair or poor, we asked them, what should we change? And I'm just going to click on the poor here, hopefully. Come on. We got this poor rating. Everyone's like, what did we do? Well, we pulled up the comment and it says everyone was helpful, pleasant, didn't even feel the shot being administered, very happy all around. So hopefully they clicked on the wrong rating. We don't know for sure, but it's data we collected and we got to take a look at it. So we left it there, but there's another lesson learned with what we were doing. So for sake of time here, what I'm going to do is our overall outcome of this was there was over 6,000 vaccinations that were administered over a 5-month period with the Survey123 dashboard system at the county.
Yeah,
and then go ahead, Siona.
And then over the 5-month period, I mean, we learned a lot throughout this process. I mean, one of the biggest things was just for Jared and I to be on the ICS team and be involved in these planning meetings. Our public health staff, and they didn't know about some of the capabilities of Survey123. And, some people think of GIS, they just think of a map and the spatial components and not the other kind of out of the box things that you can do with it. So it was really, really, I think, really important that we were on the ICS team and we were able to suggest these ideas. So yeah, just don't be afraid to provide ideas or suggestions to people because they don't know, they might not know everything about GIS. And then just collaboration was just a huge component in this. I mean, what Jared will scroll down in a little bit here, and you can see it wasn't just public health and emergency management and GIS that did this. I mean, there were so many different departments that participated in this, from IT to transportation staff to the county coordinator's office. Just this was a huge group effort and such an undertaking for everyone.
And one thing that we learned was be sure you test again. I mean, we'd run through this process before every clinic was staffed to make sure that they're familiar with it. We just make sure everything was working because there were so many steps in doing this, from screening questions that needed to be changed and just all the different domains and things on our SDE. We just had to make sure it worked and being flexible. We learned to do that a lot. We put in some long days. A lot of these clinics were late in the evenings and we were working some weird hours and long hours. So it went well. And of course, documentation. You run through these things a bazillion times and you kind of go, okay, well, I took that step, but why is it not working this time? So hopefully we don't have to do this again, but we know how to do it now. So that documentation is there. And as Siona mentioned here, we just want to kind of talk about the contributors to this success. It wasn't just GIS, it wasn't just public health, that there were so many different divisions involved with this, from individuals being traffic control to IT putting, we had shortcuts with icons pushed to the iPads for staff back, also color coded for purple being check-in. So if we have people coming on last minute, we can write, hey, check in, use the purple icon. They really helped out with that. So lots and lots of information that came through. And that's what I have. Shona, did you have any final comments that you'd like to wrap up with before we move into Q&A?
No, I'm good.
All right, well, thank you, everyone. I'm going to see if there is any comments in the chat window now. Do you see any, Shona?
Sam Giebner wants to know where Carlton County is.
Where Carlton County is? We are south of Duluth.
Excellent presentation, excellent work, great setup. And I'm definitely sure that that's been hitting the wrong button. Poor instead of excellent.
There we go.
So yeah, we still have time for any further questions or comments. Yeah, people feel free to throw them into the chat box or into the Q&A box.
Well, thank you, everyone, for joining today. It was an exciting project, and I'd have to say it was more of the one of the larger challenging ones that we had undertaken. So if you have any more questions, feel free to reach out to Shona and I.
Yeah.
Thanks, guys.
Yeah, thank you, Shona and Jared, for a great presentation. That was indeed a great collaboration and partnership of GIS and public health. That was a real example, very practical. Great work. And thank you, Heather, for your great presentation as well. And thank you all participants for your participation to the session. If you had any questions or concerns, please reach out. As I mentioned earlier, we have recorded the video of this session, and we will make them available soon. Other than that, enjoy the rest of the conference and have a great rest of the day.